Welcome, everyone. Good morning, good afternoon, or good evening, wherever you are in the world. My name is Luís Miguel Lourenço, and I'm the Professional Secretary of FIP. I'm very pleased to welcome you to this episode of Coffee with FIP. Coffee with FIP is a podcast-style mini-series designed to provide pharmacy professionals around the globe with a dynamic and interactive platform for informal, evidence-based, and CPD-aligned discussions on key and timely topics in pharmacy. These topics reflects FIP's strategic priorities and programs. Just a note before we begin. The views and expressions shared in this podcast are those of the speakers and do not necessarily represent FIP's official position. This is explicitly stated and part of our intention to offer a wider professional perspective through open and thoughtful dialogue. Today's episode is centered around the theme, the ethics of pharmacist prescribing, responsibilities in expanded practice. With me today, I'm delighted to welcome two distinguished speakers. First, Dr. Betty Chaar, full professor at the University of Sydney School of Pharmacy. Hello, Betty. Would you like to tell
Hello,
us a bit
Louis.
about yourself?
Thank you. Thank you for the introduction. Yes, my name is Betty, and I am a professor, a chair of professional ethics in pharmacy, and I've been in this domain now for 20 years without giving away too much about my age.
Thank you, Betty. And also joining us is Dr. Sanya Ram, senior lecturer at the University of Auckland. Hello, Sanya. Would you like to introduce yourself as well?
Thank you so much. Kia ora, everyone. Welcome. It's a pleasure to be with you for the next few minutes. I'm a pharmacist and a lawyer, and my background is teaching pharmacy law and ethics and exploring some of the legal determinants of health and the impact of regulations on pharmacy practice. Thank you so much.
Well, thank you both. It's a pleasure to have you with us. Let us begin our conversation with the first question. Pharmacist prescribing is expanding in many countries. What are some of the key ethical responsibilities that come with this shift in practice?
Thanks, Louise. I'll take this question, and my response would be that indeed we have over 120 countries already registered and having prescribing legally for pharmacists, which is a great pride in our profession. In terms of ethical principles applicable, we start with the usual, the ones that we practice day in, day out, that are basically based on four fundamental principles of respect for patient autonomy, to do good, to avoid harm, and to be as fair as humanly possible, justice. In addition, I will introduce you to four more principles that I suggest are very important to consider when we become prescribers. In some countries like the UK, from 2026, this year, no graduate in pharmacy will be without prescribing rights. So they are taught and trained to be prescribers. So the first principle, the main principle, to do good, beneficence. Pharmacists must act in the best interest of the patient, always, always. And this is aiming to improve health outcomes, alleviate suffering. But prescribing should be guided by evidence-based practices and clinical judgment to ensure the best outcome. The second principle is non-maleficence. You might think that it's just the opposite of to do good. It is actually the oldest principle in healthcare, and it requires pharmacists to avoid causing harm. And this includes careful consideration of drug interactions, contraindications, and the appropriateness of therapy. Prescribing should never be done without adequate knowledge. If you don't have the knowledge, please remember to be transparent and say, I don't know, and seek the knowledge. The third principle, respect for autonomy, allows the patient to make informed decision. This is crucial. Pharmacists must ensure that patients understand their treatment options, including risks and benefits, and support their choices without coercion. And this includes respect for their confidentiality and to make sure that they understand what they're consenting about. It means informed consent means having the capacity to make a decision any reasonable person could do. The fourth is the principle of justice, and pharmacists should ensure fair and equitable access to medications and healthcare services, including avoiding bias, discrimination, and ensuring that prescribing practices do not contribute to health inequities. What I will add to those four pillars, big pillars in pharmacy ethics, or in healthcare ethics actually, is the fact that being prescribers, we now have more accountability. So pharmacists are now accountable to the public and to the profession for their prescribing decisions. They can't afford to make mistakes. They must be very careful. This requires taking responsibility for maintaining competence, documenting appropriately, consulting, making judicious decisions, and being transparent about their scope of practice and the limitations thereof. The next one, which is number 6 now, is about professional integrity. To prescribe, for us as pharmacists, we have endured some very, very cruel attacks on our integrity. So to continue as prescribers and to be proud of our work, we must adhere to standards of our profession, behave professionally, with integrity, with honesty, avoiding conflicts of interest, both perceived and real, and ensuring that prescribing is based solely on clinical need. For example, not your best friend asking you for some help here and you prescribing. That is an absolute example, a good example of what not to do. It is very important to maintain your own professional autonomy. 7 is, the next one is collaborative care. The ethical principle often involving working with other healthcare professionals. We need to learn to communicate effectively, respect the roles of others, and ensure coordinated care. And the last one that I will add at this point in very concise manner is the absolute ethical requirement to continue lifelong learning. For life, ignorance is never an excuse. We can't say we didn't know, except as a segue to find out. So that, in a nutshell, is what my answer is to that first question, Luís.
Thank you so much, Betty. Thank you so much for your thoughtful answer, and also to be very comprehensive and concise. So we move forward to our second question that would go, trust plays a central role in pharmacy-patient relationships. What does it take to build and sustain trust when pharmacists take on prescribing roles?
I'll take this one as well.
Sure. Thank you. Thank you.
So building trust is foundational to ethical prescribing. There's no doubt about it. And effective care. We've been told that we're not trustworthy, that we have conflicts of interest, that we are pharmacists, we are salespeople. This can be addressed. We need to build trust, and it's essential to the profession that we do so in an ethical manner. So here are my tips. How to build trust in pharmacy. I have about 7 points again. but I'll be quick, I promise you. Be accessible and approachable. Greet patients warmly. Make eye contact. Offer private consultations when discussing sensitive issues. Ask if they allow you to close the door or keep it open. Be sensitive to these matters. 2, communicate clearly and empathetically. Don't say, oh, get used to it, or, that comes with the condition that you have. Be empathetic. Listen actively and validate patients' concerns. Listening is an art form, and communication is also an art form. The third tip I have is personalize the care. Tailor your advice to patients' lifestyle, preferences, and health goals. Be aware of them. Be sensitive. Don't tell a little old lady who's 90 years old to walk up the hill because it's good for her. Of course it's good for her, but she can't do it. So we have to be personalizing, tailoring. Remember repeat patients, the ones that come again. These are gold. These are the people who are yours, so keep them. Follow up on previous issues. Remember them. Remember their names. My 4th tip is demonstrate competence and reliability. Put yourself in the shoes of a patient. Would you be confident in your own understanding of conditions that you are working in? Stay up to date with clinical guidelines and best practices. Ensure the prescriptions are accurate and safe and clear, with clear directions. Okay. Open up for questions, answer them. Demonstrate that you have that confidence and you're reliable. The 5th one is maintaining confidentiality in a way that is respectful and mindful of the sensitivities of patient history. Sometimes you might think that something is really, bland. It's just a flu, or it's just COVID. We can deal with it, or something like that. I'm giving an example that just comes to my mind. But to them, it causes sensitivities, and it will. If you bring it up in a pharmacy or in a public area where other people can hear. So avoid discussing cases in public areas, and maintain areas that have some kind of privacy and confidentiality facilitated. 6, be consistent and transparent. Be honest about what you can and cannot do. Be honest about products in the pharmacy. We are accused of conflicts of interest. Address that by being upfront, as transparent as possible. You don't need to buy this from this place. Here's my prescription. Take it anywhere you want. Tell people that there may be a margin of profit here for the pharmacy, but that doesn't mean you have to buy it here. You need to address the fact that you might be accused of a conflict of interest. Be aware of it and deal with it. If, heaven forbid, a mistake happens, admit to that mistake and take steps to correct. Okay. So being consistent and transparent is a really important thing. My last tip for building trust and keeping it, maintaining it, is offer support beyond medication, beyond the product. Think about lifestyle. Think about adherence tools. Think about preventative care, and try and adapt that for your patient to whom you are giving your full attention and listening to actively. So those are my tips, Louis. That's it for me.
Thank you so much. Lovely as usual. And move forward to our 3rd question. So conflict of interest and patient privacy are often discussed in the context of prescribing. What are some real or perceived dilemmas pharmacists might face, and how can they be managed? I think Sanya would like to actually answer. Yeah, sorry.
Apologies.
There you go.
Thank you so much. I'll take this question. There's quite a lot of interest in the conflicts of interest, especially when you've got the dual role of providing healthcare, but also balancing your books and making sure that your business is viable. And so in terms of ensuring that those dual roles are separate and the professional boundaries are clear and that you're making clinical judgment aside from business interests and making sure that that line is very clear and that your prescribing decisions are clinically justified. And so, managing your financial incentives and making sure that your ethical boundaries and your reasoning and your frameworks stress that transparency and that you're actually prioritizing the patient and their needs and their clinical needs over and above anything else in terms of commercial interest or financial gain. Then the other one that springs up quite a lot in discussions around conflict of interest is industry influence, right? And so what you're trading is your professional autonomy with, some of what you're willing to give away. And there's many guidelines around to ensure that you avoid such relationships and ensure there's transparency and integrity in how you are providing a service. And there's certainly legal boundaries in terms of misleading practices as well, and fairness in trading. And so all those principles that Betty talked about earlier apply in how you would manage some of these conflicts of interest and ensure both perceived as well as real becomes important when you're looking at a profession and how it could be brought into disrepute. So being very clear in ensuring that those principles that Betty has talked about earlier, comes to the fore in every decision that you're making. And both conflicts of interest and patient privacy are critical in the trust we need from our patients in order to be able to do our jobs, especially in prescribing. And so maintaining privacy, patient privacy is critical. And as a prescriber, you do need that information, those integrated health records and being able to electronically access them. And you've got data sharing going on as well to ensure that you've got the diagnosis right or lab tests right. So you get access to greater information, but with that comes greater responsibility and ensuring not only there's confidentiality, and as Betty talked about, talking in open spaces, being on your phone, even to your patient, while there's in the middle of a pharmacy and lots of action going on and lots of people there on a bus, on a train, how you treat that information is incredibly important. And prescribers definitely have a higher threshold in ensuring that they protect patient health information. And especially when they're accessing electronic health records, you've got that responsibility of ensuring digital security as well. How do you destroy that information, especially with e-prescribing systems? Pharmacists need to ensure that they adhere to the local guidelines, the laws in protecting privacy and the privacy acts that exist in many jurisdictions to ensure that, we're handling sensitive data. We don't want breaches of that data. And it's the small things that may lead to those breaches, and to just be aware of that. You've got ethical codes worldwide that stress that integrity, transparency, letting your patient know why you're collecting that information, ensuring that you safeguard that information and you only use it for the purpose that you're collecting it for, and ensuring that any digital system is backed up with fair security measures that most jurisdictions would have regulations around. And so the emphasis is on that pharmacist moral courage to stand up and ensure that we protect and we have that duty to our patients, and ensuring that we're not bringing conflict of interest and breaches of privacy and security into the mix.
Thank you. Thank you so much for your input. And time really flies. Now I'm going to just raise the fourth and last question of our coffee with FIP. Based on current prescribing models, what competencies or support systems are essential for pharmacists to prescribe both safely and ethically?
I think it's a fabulous question. We've got an amazing bunch of pharmacists who are very capable of delivering and prescribing and maintaining that access to medicines. But as we have emerging trends of AI and innovations, digital health, we need to ensure that there's flexibility, but also clarity in the guidelines and the regulations that exist in each of the jurisdictions, having very clear regulatory and professional oversight by our pharmacy councils, our professional bodies, having ethical codes and discipline frameworks makes it a little bit clearer. I think there's two things that we need, both in terms of competence, but also having the support systems. So, your mentorship and your peer support, and as Betty talked about, continuing professional development. As we emerge into innovative territory, we need to ensure that we've thought about what regulatory oversight we need, what clear standards and guidelines we need, and also sharing this universally. Some of the issues we face globally, shortages of both health workforce as well as medicines, combined efforts would help us. So, sharing that regulatory intelligence globally, and also ensuring that there's clarity and scope of practice, but also patient safety and constantly evolving with those trends that are going on. I mean, we look at the use of AI and the digital health platforms, security becomes an issue, and that's universal, right? Globally, we can tackle some of these issues to ensure ultimately it's continuity of care, accessibility, and we're dealing with the most trusted healthcare professionals and pharmacists who are trained in clinical governance, trained in accessing and those evidence-based medicine guidelines and prescribing. So it's not just about workforce efficiency, it's also about improving access and outcomes. And so with these extended roles, critical to delivery of healthcare, we need to ensure that we have clear ethical boundaries, guidelines, standards, and support systems, but also clear regulatory guidelines. Yeah.
Thank you so much. Well, I think we could stay the rest of the day just talking about this topic. It's really exciting. So it's a cutting edge issue that we've been discussing for a while, and actually you are coming to an end of our podcast. I'll just keep some major points that were discussed just to keep in our mind. We spoke about ethical principles, the importance of building trust with the public, integrity, conflicts of interest. One thing I'm sure that most of our participants, if not all, would just want to learn more. So I think everyone should be invited just to know what FIP is doing in this regard about ethicals. We do have an ethicals advisory group with whom I have the honor to chair with Betty, and in which Sanya is also a member. So that's great. So being saying that, I'll just move forward to the closing remarks. Thank you both for your thoughtful insights and for joining us in the important discussion of the ethical responsibilities in pharmacy prescribing. It has been a pleasure having this conversation with you. And thank you to all of our listeners for turning in this Coffee with FIP episode. We hope you found it valuable and engaging. Don't forget to explore other episodes in the series and stay connected with FIP's work and programs. Until next time, take care and goodbye from all of us at FIP.